If you can hear me, clap one time. If you can hear me, clap two times. If you can hear me, clap three times. Awesome. Welcome. Hello, everyone. Thank you for your patience. I greatly appreciate it. I need to start bringing an adapter with me now. We're back in person. I have not facilitated an in-person workshop in probably 3 years. So, congratulations. You get me at my rusty point. Hopefully this is fun. My name is Sean Smith. I'll go a little bit into my introduction later. I'm here representing Global Foundation for Girls, and our goal today is to explore the critical role of BIPOC-led funding intermediaries in advancing birth justice. We'll examine some unique challenges, talk about collaborative efforts, and then go a little bit into our current regranting initiative that we're working on. We recently received some funding from the Robert Wood Johnson Foundation and provided awards up to $50,000 to over 20 organizations across the country, a couple of which are actually based here in Chicago, Illinois. So, a little overview of how we're going to do this. So, understanding birth equity, so some didactic learning there, just a little bit of the history and knowledge that you all are probably familiar with, so we won't go too much in that. Talk about the birth justice framework, and then some systemic barriers and challenges faced by community organizations and also funding providers, the impact and importance of community-based care, and then the role and benefits of funding intermediaries. I'm going to drive that home with an interactive exercise. Our objectives today: understand the role and importance of funding intermediaries, identify challenges and opportunities, develop collaborative strategies, enhance community mapping skills, foster a community-centric approach, and encourage active participation and network. Again, my name is Sean Smith, Program Officer with Global Foundation for Girls. I'm also the Principal of Humanist Perspective Consulting, which is a social impact consulting firm that provides services and resources and capacity building support to under-resourced and minoritized nonprofit-led organizations and businesses across the country. The clients that I work with, including GFG, work across a range of social and health equity issues, including HIV/AIDS, intimate partner violence, birth equity, housing stabilization, and food insecurity. And I'll let my colleague introduce herself.
Hi everyone, my name is Jess Kimball. I am the Director of Programs at GFG. I oversee the Birth Justice Program, as well as the Family Fund, which is our regranting with Robert Wood Johnson. I also am a birth worker myself and support families in my community in North Carolina. I work with the National Midwifery Institute, so I'm very passionate about the midwives' model of care and really just empowering birthing individuals, especially Black birthing families, to make choices about the birth that they want and be able to access resources to achieve the birth that they want.
Awesome. Can you all hear me without the mic? Great, because I am a hand talker. And that's
I'm gonna set this down.
So great. So we're going to, a little bit of background about the Global Foundation for Girls. It was founded in 2020, although it was a concept in 2010, so still a relatively new organization. The foundation serves girls as an intermediary, advocate, resource provider, and network for community organizations that works, again, across that spectrum. Our method, we act as a modern-day Harriet Tubman, so that means we funnel resources to organizations from larger philanthropic organizations and donors, and then fill that money into the community, so that they're able to make their impact how they best know how, right? We have a trust-based philanthropy process. We give them the money, and as they say, you stay out of our way. And so we make sure that we really drive that home. Our focus areas, again, of course, birth justice. We ensure equitable access to maternal health care, advocate for culturally competent care and birthing practices through our policy work, and then address disparities in maternal health care outcomes and advocating for policies and initiatives that promote safe and respectful birthing experiences for all. We also do some advocacy and empowerment leadership, and so we've collaborated with organizations such as the Obama Foundation, the UN General Council, a couple of child health welfare organizations, both locally and globally as well, on policy initiatives. for issues affecting children as well as women. And then our primary work are trust-based philanthropy and grant-making initiatives, which prioritizes community input and involvement in our grant-making decisions, and we ensure that our funding aligns with the needs and priorities of the communities being served. So I'll talk a little bit about our grant that we're working on, the Caregiver and Family Leadership Grant, with the funds that we received from RWJF, and how that was a trust-based practice process. They actually provided us with a family advisory council, and the family advisory council was able to make the decisions on the organizations that would get the awards. They collaborated with us on a matrix that we used to score the applications, and provided us with feedback throughout the entire process. We work again across the globe, mostly in the Caribbean, here in the United States, and then in some Southeast Asian countries as well. Jess.
I'm gonna try using the mic, and then we'll see if I end up wanting to talk with my hands too. I think we all kind of have an understanding of what birth equity is. That's why we're all here. But I think it's important to understand how our organization looks at birth equity and what work we're doing. Birth equity is defined by the National Birth Equity Collaboration as the assurance of the conditions of optimal births for all people with a willingness to address racial and social inequalities in a sustained effort. This could look like advocating for policy change, working directly with birthing families, working with clinics to integrate birth equity practices, and other programs and activities that are centered around education and systemic change that leads to birth justice. Birth justice is a practice that centers the birthing person and focuses on their empowerment. It recognizes that the individual that is giving birth is the best person to make choices about their body and their birth experiences. We support several birth equity policies, one of which is the UN Convention on the Rights of the Child. This is an international human rights treaty that outlines the civil, political, economic, and social, I'm going to put this down, health and cultural rights of children. The U.S. currently has not signed on to ratify. We also support the Convention on the Elimination of All Forms of Discrimination Against Women. This is a 1979 treaty adopted by the UN. Again, we have not ratified. We support violence against women. This act was passed in 1994. It's a U.S. law that provides funding to investigate and prosecute sexual and domestic violence crimes against women. And then we support birth justice. We provide resources. We advocate on statewide policies. Again, our work is global, but a lot of the birth justice work we're focusing on right now is in the U.S. because of the maternal health crisis. So within this framework, we have a focus on human rights empowerment and access to resources. The human rights portion includes basic reproductive and maternal health care and policies and laws that protect that access. Empowerment includes advocacy and autonomy in the decision-making of birthing individuals, and then resources used to achieve the optimal birthing outcomes based on the goal of the birthing individual. These decisions are extremely personal, and what might be the goal of one birthing person, say someone really wants a natural birth at home, someone else may just really want just no health complications to come from their birth, and however that's achieved is okay with them. So it's important to speak to people individually and understand what it is that they're looking for. There are many challenges and barriers for providers as well as for families. So we have a video that shares some of the common experiences that are unfortunately happening.
Now on to the silent crisis in our nation's maternity wards. African American mothers dying at a higher rate than any other racial or ethnic group from childbirth-related complications. Families affected by this tragedy share their stories on the day their lives changed forever. Janae Norman has this report.
What was supposed to be the start of a new life turned out to be the end of another. 26-year-old Amber Rose Isaac was preparing to give birth at the height of the coronavirus pandemic in New York City in April when everything changed for her partner Bruce.
And I just remember staring and, looking at her face and seeing how scared she was, panicking a bit. So I'm telling her, yeah, we're going home. This is what we prepared for. This is what we were ready for. This is time. And she looked at me and said, yes, all three of us are going home. And that was the last time I seen Amber.
Amber posted on Twitter about, quote, dealing with incompetent doctors. She died 4 days later. Bruce says Amber tried advocating for herself, but doctors just wouldn't listen.
When she voiced her concerns to her OB, she was letting her know, she's not feeling right. She's feeling a lot of discomfort. She's having shortness of breath. And her OB didn't really understand. She was like, oh, well, there are other women who are working while they're pregnant. So that right there just told me she didn't really care about Amber.
In a statement, the hospital spokesperson saying 94% of our deliveries are minority mothers, and Montefiore's maternal mortality rate of 0.01% is lower than both New York City and national averages. Adding any maternal death is a tragedy. Amber's story is not uncommon. July 2nd, 26-year-old Shaija Washington died during an emergency C-section. And July 27th, Yolanda Kadima, a doula and mom of 7, died giving birth to twins, also during an emergency C-section. Experts like Professor Deirdre Cooper Owens, who's written about how race and gender impacted American gynecology, say the struggles these women face throughout their pregnancies and childbirth all come down to racism.
You see that class and status tend to matter. The higher up you go, right, the kind of better protected you are. That doesn't exist for Black women because we're all experiencing racism in the same way. So when I walk into the office, nobody knows if I'm married or have a PhD or what my income is. The assumption is I might be lying, maybe I'm promiscuous, maybe I don't eat well. I should still be given fair treatment and equitable treatment by my doctor.
My first pregnancy, my birthing experience was pretty traumatic.
And he actually punctured my spinal cord. I was temporarily paralyzed.
We were so excited about bringing Jace into this world, and then the last 2 or 3 days of his birthing process was too tragic.
I was bullied and I was abused emotionally and physically, in the sense that consent was not asked for as often as it should have been.
It took me a while to find a provider that I trusted and that respected me.
We lost him due to what is known as HELP syndrome. We found out later on that his death could have been prevented, as well as the traumatic birthing experience that she experienced.
So many Black families with similar stories, and these experiences add to a mistrust between the Black community and the medical community, a relationship with a long, dark history dating back centuries.
Enslaved Black women were experimented on, particularly during the 19th century. So a little bit in the 18th century, but largely in the 19th century as obstetrics and gynecology became more formal and accepted branches of medicine. Marion Sims, known as the father of American gynecology, pioneers the surgery to correct this obstetrical fistula condition. People didn't know that he experimented on enslaved women. They didn't know that 2.5 years into his experimental trial, when his white medical assistants quit, he trained these enslaved women to serve as nurses. They were still his patients. They were still his slaves that he either owned or leased, and they still served as surgical assistants. So that part of the story was left out.
The success of James Marion Sims earned him the nickname of the father of modern gynecology. But his legacy is marred by the fact he earned it on the backs of Black slaves through non-consensual human experimentation without anesthesia. Now, doctors like Jennifer Lincoln, also an OBGYN, are fighting against present-day health disparities.
To this day, Black people are less likely to get the same treatment in terms of pain medication
They're more likely to wait longer in the emergency room. They're less likely to be taken seriously. It's a holdover from the days of slavery. And in my field, this plays a huge role in the Black maternal and morbidity crisis. The call to action, doctors, nurses, anybody in the medical field, check your implicit bias.
Staggering statistics show Black women in America die during childbirth nearly 3 times more than white women, making the United States one of the most dangerous developed countries in the world for Black women to give birth. And doctors say the issue for mothers extend through pregnancy and postpartum, and also impact Black babies, who are more than twice as likely to die than white babies.
So higher rates of complications related to childbirth and pregnancy as well. It's huge, and it's something that in a population, childbearing women in general are young, healthy women, and then these are not women who should be suffering these extreme complications or be dying, especially in a developed country.
Now on to the silent crisis in our nation's maternity wards.
As you saw some of the themes in the video, anything stick out to you all as funders in the room, as individuals who are working with birth organizations? What's relevant to the work that you're currently doing? Anything stick out? How you feeling? Yeah.
I think because I've been so close to this work, the thing that sticks out to me most significantly is there was a time in the field where we didn't appreciate storytelling and centering things in those directly impacted by inequities on different levels. But I contend that over the last 5 to 8 years, and I'm from Georgia, by the way, for context, we've done a lot of storytelling. We've amplified a lot of voices, but yet the situation still persists. And I think that would make us ask more interesting questions. Is it lack of awareness, or is it something more insidious?
Absolutely. Anybody else? As a funder, were these issues known to you? Was there any shock value in anything that you learned? Good. Yeah. Go.
So I was going to say that as a funder, one of the things that stuck out to me is that these things are coupled within policy, and so you have to, number one, fund policy work with your partners, so you can't not do that, but also be willing to do that policy and advocacy work on your own. I know a lot of funders, community-based funders, won't fund advocacy work, and you can't really solve this problem just with direct practice.
Absolutely. And as a consultant, that's one of the challenges I've had with a lot of my clients is, how do we get to a point where we can shift the narrative of the organization and the focus of the organization without losing the essence of the work and the mission of the organization in response to funders' needs? But also as funders, how many of you are actually deeply engaged with what the organizations are doing? How much are you taking into context the language that you're using versus the impact that they're making, right? Those are all considerations that we have to take, especially coming from the perspective of a community-based organization where they have limited access to funding, and most of the resources, of course, that they're already using is going to overhead. It takes sometimes 5 hours to write a grant application. So that's now 5 hours I've lost of being able to invest deeply in my community, understand the issues that are affecting my community, making some type of strategic partnership or connection with the politicians or policymakers in my community as well. The systemic racism,
I'm totally ruminating on what you said, and I'm a little slow. But so I do a lot of work in substance use, and it's actually it's not insidious, it's kind of obvious. So when they have the voices of the Black people speaking about their experience, trolling, hostility, when it's a white person talking about their substance use, everyone's like, oh, we have to do something. And it's like killing me. And so, but then funders always talk, I'm not a funder, I want to be clear, I used to be a funder for Society, but not now. But then funders are like, we're going to fund narrative change, and they never get into that piece of it. And it is so important because it kills us. We know that the nation is absolutely racist. And then we're like, well, what we'll do then, since people are okay with white faces, we'll put the white faces up there, which guarantees we're still going to die. And so it's very frustrating, and I don't, if I may, also, and I don't want, so no, I feel you, and I'll
And I'm going to say this as kind of individual and not a representative of Georgia Health Initiative, to be clear. But when I use the word insidious, I use it on purpose for a few different reasons. And I come from a place that addressed the immediate needs of our communities as well as did systems and policy change work. But at the end of the day, with those who have the time, treasures, and power, they don't see certain people as people.
Yeah.
So I think it's very novel or notable for us to want to change systems. And I appreciate that, right? But the systems are working exactly as they were designed to work. And there is a reckoning now that I feel like we're all navigating in the United States specifically, but in a lot of these westernized cultures where we know it's there. We know there's an attack on reproductive rights, womanhood, right? And what do you do with that? When people don't see you as a whole human, both from a racial lens and from a gendered lens, and you try to address that with our altruistic hearts.
We cannot DEI our way into empathy. It's not gonna work. You can't teach.
Say that again.
You can't DEI. It's never gonna be a thing. I think that what we have to move toward, right, is sort of intrinsically linking those things into any of the issues that you're facing. Because if they're impacting me, they're impacting you in some way, shape, or form as well. Whether that is your increased cost of healthcare because healthcare organizations are based on racist practices, which then drive up, we need this medication or we need this technological resource because these populations differ in the way that this population is experiencing this issue, right? And it's not always the case, right? If we start to take a more systemic approach to examining how those things are intrinsically linked, how can substance use and HIV/AIDS communities and intimate partner violence communities and birth equity communities all come together to start creating ecosystems of resources and services and support so that we can then resolve the issues that are collectively affecting us.
Just one quick comment about US, which shocked us, me or us, is that along this vein, they decided to air a white OB talking about implicit bias, like check your implicit bias when you know that's not working, and it kind of confuses the narrative a lot.
Yeah.
Like, okay, so what is it? Is it systemic? Is it ingrained in our legacy and how systems are designed to work, or is this thing that just check yourself? So
it's profitable.
I bristled at that.
It's profitable. That's the thing we have to understand, right? Until we start attacking the economics behind it, we'll never solve any of the issues. It's a profitable system.
Just before we move on from the video, just because it's something that's always in me, because we talk about Dr. Marinson's and the women that they weren't women, they were girls. They were teenage girls. So I always want that to be known. They were not women. They were teenage girls who were over 20, 30. It wasn't an experiment. It was ongoing, very long, arduous experiment that made folks disfigured and paralyzed for the rest of their lives.
Yes, thank you for saying
I think there's one more.
All of the conversation is really resonating with me because I work at a national intermediary foundation at times, and I think when I got into this work with our initiative around reproductive justice and health equity as a whole, I really questioned myself, should I be in this seat? But the narrative change that somebody mentioned is only going to go so far if the person who is sitting in the seat to allocate resources does not believe that our pain and our joy is okay.
Yeah.
And so we are also led by a Black woman who's our CEO. And so I think people who are program officers in the room know that one of our jobs is to fight for the vision sometimes. And so I just really resonated with what you said, that narrative change is only going to go so far if the people who are sitting in the seats are not believing or have not experienced or feel divorced from it, right? Like this work is not just, I consider myself part of the community, right?
Yeah.
So,
I feel like, sorry, this is not getting totally deep.
This is great.
Don't worry, we'll come back. We will come back. We will always come back. Don't worry.
I'm loving this conversation, and I think that difference between narrative change and empathy building is really resonating, especially when we think about who holds power. And I think about how little proximity people in power have to what is happening on the ground. Like, I literally heard, I didn't know doctors could be racist. That's like an actual statement that I have heard. And, you know, I think about, we have an organized, not a grantee, but a sort of in our ecosystem, who was working on like a little like sheet, a little like toolkit on gender diversity for OBGYNs. And it was like, step number 1, ask people what their pronouns are. And, you know, there was all of these things that were so superficial, and it was like, it's not just, don't just give them like a list of things that they can do to be politically correct. Like, how are you building empathy among providers about what it is like to go through a system that was not designed for you? Like, what does that look like? And I would love anyone's thoughts on successful empathy building initiatives.
Yeah. So I don't know how successful it was. One of the projects I did work on with the funder Gilead, Gilead, ViiV, healthcare, all sort of the same. They kind of sit under that GlaxoSmithKline umbrella, but they worked on a couple of place-based initiatives, primarily focused on HIV/AIDS among Black, gay, and Latino men in Baltimore and Jackson, Mississippi, which at the time, this was 2018-19, were the 2 hardest hit cities for the HIV epidemic and new recurrence of infections. And one of the things that we did was partner with a sexuality research collaborative in Pennsylvania to develop a curriculum, both for individuals who were seeking services as well as service providers, healthcare providers, to teach those sorts of things. So teaching the patients how to effectively advocate for themselves in front of their providers, teaching them what to discuss, working with barbershops and churches as well to establish spaces for those conversations to happen. So moving outside the traditional realm of just, people who know what the issues are and actually the people who are closest to the people, right? I'm going to the barber every 2 weeks. It's one of the most intimate conversations I'm probably going to have, twice a month, right? Are we training those individuals who are directly connected to those people to then have those discussions, right? What would it look like if you went to church on Sunday and your pastor is saying, don't forget to go get your health checkups, don't beat your wife, from like very common sense things, right? But from the people who are frequently more visible to those we are trying to serve.
And I totally know the program, awesome. But I think the other piece is, and I say this as a pediatrician, you have to start bringing different people in the profession.
Yeah. Absolutely.
Right?
Absolutely.
We need to throw away the old way we chose people and bring the folks who are closest on the ground. So they're the birth workers, the doctors, the medical assistants, the whomever, and stop having these people that we know are brought up in the racist system, thrived, made tons of money in the racist system. Now going to teach them empathy is freaking hard. It has kicked my ass. Excuse my French.
No, you're absolutely right.
I was going to say, for us, I think the concept of empathy is inconsistent and unreliable. And so you can't really rely on it to do system change work. Yeah. So that's why we focus so heavily on big and little P policy and on workforce development, specifically around the birthing workforce, and how, twofold, how we bring more people into the workforce and how we make the workforce more hospitable for those people once they arrive. Because trying to teach empathy is like a coin toss. Like 50% of the people might get it, but then you still have the other 50% of the people that
Yeah.
Well, once we build up the workforce, we can just keep, moving people out.
I'm gonna stop because you have.
No, you're fine. I'll wrap that up by saying, in addition to that, it's important to, move back to a space where we are teaching and our movements are based on accountability politics, right? If the people in place who are making the decisions, again, are not aware of the issues, and the people who the issues are affecting are not aware how to appropriately advocate for themselves in front of those folks, we're never going to get anywhere, right? So we have to move back to a space of accountability politics, holding people accountable. You're in the position. This is what you promised. I remember. You wrote it down. I wrote it down. It's on the record. If we aren't in the space of it is flashing lights in front of people's face and making them uncomfortable, we're not going to solve very solvable issues.
Yeah, I think so much of the work that I do, like I come from a big family. I grew up with my doctor growing up was a Black woman, so I thought doctors were Black women, and that really shaped my experience growing up in a white community, but my doctor was a Black woman, so every Black woman to me was supposed to be a doctor. And then I grew up and I realized that's not how most people grow up. And I think that so much of what I've been taught is we change the world by raising good kids. And I don't think you can teach an adult how to practice empathy. I think you can teach them to be respectful, and you can teach them to be polite. So they will ask you what your pronouns are, and they might make an attempt to try to pronounce your name correctly. But I was taught my name means so much to me. It's my identity. And if I care about someone, I want to know how to say their name, and I want to know how to greet them, and I want to know about them. They're a human being. But that was taught to me as a child. I don't know that we can teach it to adults. So I think it goes back to all of the early childhood intervention programs and making sure that kids that aren't growing up in high-income households still have opportunity to go on and become the incredible Black doctor that I had. And I think that video highlighted so much of it's happening in communities. And I think although we can't teach empathy to adults and storytelling might not be the answer to all of it, having these spaces where we can have conversations and the people leading conversations are people who have the lived experience. I can go read every book in the library and talk to everyone in the world, and I will never be an expert on birth justice. And I'm grateful that I am thankful to be in this group of people right now and be allowed to speak here. I can take my experiences and say this was hard, so I imagine for someone who has even more barriers, it's even harder, but I don't know what harder feels like because I'm white. And that's always going to be my lived experience. And I think being in a space where I can listen to other people talk and learn from them and practice that empathy and then try to work the system to make changes. But I think it's just about talking and speaking openly. And having spaces and community to do that, and hoping that one of the people that's in the room listening is someone who has a connection to money and wants to use that money to invest in change. I think it's important when looking at community services and community-based providers to understand that 80% of maternal deaths are happening in our communities. They're not happening when someone is in the hospital giving birth. It's happening in pregnancy. It's happening postpartum. A lot of these deaths are linked to behavioral situations like perinatal mood and anxiety disorders. So it's not just the provider who's catching the baby at the birth that we need to work with. It's the people who are supporting the pregnancy and working in the community. And I want to go back just to this slide. I think it's important to understand the role of community-based providers and the barriers that they face in accessing funding. I work with the National Midwifery Institute. We train certified professional midwives. We don't get to access Title IV funding. And so many of our students are Black student midwives. And we know that there's all of these barriers that were put in place to prevent Black midwives from practicing. And we see that in the separation of CPMs and CNMs and how each state has different licensure processes. Some states have outlawed CPMs from practicing. There's so many layers to it. our school doesn't access Title IV funding. So if we want to offer scholarships, we would need to charge higher tuition and hope that we're making enough profit to then pay the tuition of our Black students. And we want midwifery education to be free for our Black students. But there's this imbalance in trying to figure out how to fund that, and we don't get to access the same funding as larger institutions. And a lot of times grants and donations are going to larger institutions, which is kind of pushing forward the system of you need to go to midwifery school and practice midwifery in this way, which was set up in a way to restrict the way that Black midwives could practice. It was set up to get rid of Black midwives, and now we're saying this is the only way you can access financial aid and afford to get this education, which is problematic. And then there's the part about, well, there's so much historical and cultural context to the way that midwifery is practiced, and Black midwives might not want to be nurse midwives. They might want to be CPMs. They might want to practice in their community. So there's all of the systemic barriers in accessing funding and education. And then we see that the underinvestment in community care is limiting the choice. If somebody wants a home birth, but they're a Black birthing person and they want a provider who looks like them and understands the background they come from, and someone that they really can build trust with, but these Black midwives are only going through nurse midwifery programs and are practicing in the hospital, well, then that person who wants a home birth but also wants a Black midwife might opt for a hospital birth. They may also opt for a hospital birth because it's the only thing that their insurance will cover. And private practice midwives may not be able to offer sliding scale rates or some kind of scholarship to cover services for a family because they are not accessing funding that larger institutions are accessing that covers the services for the families. And then we see hospitals are starting to create doula programs as ways to reduce poor maternal health outcomes, but those doulas are volunteering their services. So it is pushing forward the system of this work we're doing is supposed to be free, and that's extremely problematic, especially for Black birth workers, to have this idea pushed that like you're meant to do this service for people and you're not going to be paid for it, and we're not going to let you use it as a way to provide for your family, which is always mind-blowing to me no matter how long I work in this field, because Black birth workers created birth work in America, and then we're saying no, you're still supposed to operate in this way that to me is a continuation of slavery. Work for free and support families. And it really just, it is pushing forward this system that's extremely problematic and unfair, to put it simply. And we know that the midwifery model of care has the ability to reduce the maternal mortality rate by up to 80%, according to the World Health Organization. We know that this model works. We know that trust between provider and patient is extremely important. As we look at, the different areas that birthing families live in rural areas, in the presentation that we were just in, they were talking about how sometimes it's easier to have the midwife travel to a rural family versus trying to have that family travel to the hospital. I mean, my mom gave birth in the car on the side of the road to my brother, and I don't think she'd want to do it again. I don't think that's like something that we should be setting people up for. It was baby number 3 and it worked out for her, but it wouldn't go that way for everyone. And to be able to be at home laboring safely and having the provider coming to you instead of being uncomfortable in a car is a better situation. But there are so many people who work in policy who don't understand the importance of midwifery, the different types of midwives, what they're doing, and really how they're impacting families, which I think is where storytelling comes in. But yeah, there are just so many barriers, and when community-based providers can't access funding, the choice in that kind of intimate birth is so intimate, and it's so personal to the family and what their goals are and their hopes are. I mean, that's a moment that they're going to remember for the rest of their lives, and it's going to shape who they are as a parent and how they show up in the world. And to take away that choice, I just think is really wrong. So I think that there is a huge need to invest in community-based providers and kind of work around this inability to access funding that happens because maybe they're not a nonprofit, maybe their annual budget is too low to qualify them for certain grants, maybe because of the type of provider that they are. So the model that we use, the intermediary model, I think is a really good solution of trying to help connect those community-based organizations with funding, and hopefully spark some change in communities and work through some of the problems that I just listed and the many other problems that exist.
And one of the ways that we do that, I mentioned previously, is through our Caregiver and Family Leadership Grant. So we awarded 20 organizations across the country. You can see the spread out there. It's kind of tiny, I know, but they do a range of work from providing licensure support to midwives and making sure people in their community are trained on policy and advocacy work. They are doing training midwives and doulas on the southern border to catch women who are immigrating into the country and crossing the border there. And there's a big need in that space because, of course, there are language barriers, there are cultural barriers to being able to understand those connections. This was mostly and primarily focused on caregiver and family leadership. So a lot of the organizations aren't doing direct service work, but what we wanted to see was if they could come up and they were able to both invest in a new program, a program that was already existing. They could request program funds or general operating funds. We made sure that they were aware of what was going on each step of the process. Our scoring rubric was actually a part of the application, so they knew the areas that we would be measuring before they were even submitted the application process. We provided access to training and capacity building support for them as well. So if they had issues at any time, they were able to schedule a call on a Calendly link, so they didn't have to go through the arduous process of back and forth emails. What days work for you? The schedule was predetermined and set. And then we also provided opportunities for cross-collaboration with them as well. So they were able to engage in a couple of our Instagram live sessions and share their own expertise and learnings with the other organizations in the cohort. We're hoping that we can get this program renewed to continue the funding and expand. When we, of course, went to the organizations and asked, what else do you need? How did we perform? You were great. You stayed out of our way. That's what we needed. Now, can you find us more money? And that's why, we're here while we're continuing to do the work, because many of the issues that Jess listed, we're able as a resource intermediary to quickly and rapidly get those funds out. This entire process from notification of funding from the Robert Wood Johnson Foundation to awarding the grantees happened over the course of 4 months. So this was a very quick and rapid turnaround for us, and it was also a pilot initiative of ours. So there was a lot of learning on our behalf as an intermediary, as well as a lot of learning from the grantees' behalf as well, because many of them said, like, this was the first time we were actually able to receive funding. This is the first time we were able to receive funding that didn't come with a mountain of restrictions, including our reporting requirements. Our reporting requirements are report how you see fit. If you want to send us pictures with captions about the work that you've done, if you want to do a quick and short 15-minute video or 30-second video to talk about the impact of the work that you're doing, if you want to send, a comprehensive final report, that's great as well. But whatever works for you and how you're able to effectively share the stories and successes and the challenges of your organizations. We spent a lot of time also begging them to criticize us and criticize the process, so that way we could learn from the mistakes that we were making and more effectively usher out resources to them in a more rapid manner and a more intentional manner as well. They miss meetings, and I let them know it's okay. We miss meetings. It happens. We're human, right? You want to reschedule the meeting, and that helped them to relieve a lot of the anxiety, a a lot of them mentioned that, this was a process where they felt like they could actually breathe because they were aware of the information that was going on. They were aware of the process and where it was. They were able to connect with us when they wanted to and they needed to connect with us. They had the free reign to pivot if they needed to. So if their projects weren't quite going as they thought they would when they made the initial application, great. Let's sit down and strategize and figure out what's working, what's not working, and how we can adapt this to make sure that the funds are being adequately used.
Yeah, I think so many nonprofits are started with someone who has this little bit of passion and wants to do the work in their community, and then they get in over their head with reporting and all of the capacity building pieces, and our goal is really to be there to support them through that as they're accessing funding. And
I have a question. Can you talk a little bit, can you unpack the word intermediary a little bit more? In particular, I'm interested in different types of intermediary structures.
Yeah. So there are funding intermediaries, which are solely focused on getting dollars. So for example, you may be responsible for a multi-million-dollar giving initiative at a large hospital that you're working with. This hospital has created a health equity portfolio like Robert Wood Johnson did. And they went to an intermediary and they say, you're actually more closely connected to organizations in this space doing this work. Can you, we have an extra pot of money laying around. Are you able to funnel this money out? There are also technical assistance and capacity building intermediaries, which are solely focused on infrastructure strengthening, skills building for both leaders and organizations across the spectrum of the work that they're doing. So, for example, a lot of our organizations were challenged by developing effective KPIs to measure the effectiveness and impact of their work. They also were challenged by engaging boards. That is a huge challenge across the spectrum, especially for those organizations that are led by BIPOC-identified leaders. Right? They say that all the time. We can't get people to help us fundraise on our board. And I tell them they shouldn't be on your board. A part of that, it is okay to be a working board. It is okay to be a person who's connected to the organization and want that experience. And I, advise them, create work groups, create committees, right? That's not your board. Your board should be focusing on your structure, right? Your sustainability, your long-term strategy. If you have an organization and no strategic plan, you're just an idea, right? You need to develop a strategic plan. And those are the conversations that we have with them through the capacity building and technical assistance. And then there's an intermediary that's just solely focused on resource building, networking and partnership building. So we have a connection to a larger foundation, and while we may not have the money that fits into this particular organization's focus area, we have the connection to an organization who can provide you the necessary support and put you in the rooms that you may not have been available to access otherwise. So those are the various structures, and then we operate across that spectrum.
And are they organizations? Can a donor advised fund be an intermediary, for example?
Yes. I think so the primary structure that you see, donor advised funds like Tides, that does a lot of re-granting initiatives as well. They operate so sometimes as fiscal sponsors as well. So the organizations don't have to go through the process of getting their 501c3 certified. You also see some private organizations as well that are re-granting funds to, community banks are another one. I sit on the board of a Philanthropic giving initiative that provides funding across DC, Maryland, and Virginia, and they partner with banks, private donors as well to then re-grant funds. So that's another structure, is the giving circle, community giving circles. Yeah.
I know that a lot of intermediaries, we're trying to, and that I know this is a lot of topic of recession, is about shifting who those intermediaries are. They're not just part of the same system.
Yeah.
So can you talk about what would you like different from funders if it's a BIPOC-led intermediary versus non-black women intermediaries. Could you talk about specifics?
Absolutely. I think one of the primary things is just to reduce some of the burdens that come with receiving the funding. Application processes are too long. It should not take me, and I think that's across the spectrum of funding, both, private and as well philanthropic as well as government. Government applications sometimes can take 2 to 3 weeks to complete, right? And grant writers for federal grants are not cheap. I think also building space for overhead, you have to fund personnel. You have to fund capacity building. That is one of the primary requests that we receive from organizations, and more capacity building support, because they know how to do the work. They may not always have the knowledge of the interworkings of the system and what is required in terms of, certificates and who do I connect with on a policy level, but they know how to do the work. And so when you provide them the resources and remove some of the barriers from them being able to do the work, you get a massive return on your investment. When they're, not in a space of operating from stress, and if I make this mishap or I didn't meet this reporting deadline, my funding's going to get snatched. And now, the community, and it creates this continued cycle of harm. We are, duplicating sort of adverse outcome effects, right? So I think that's really the thing, is the administrative barriers that are in place. And after that, everything else becomes simple.
Thank you for that. And I'm also asking, I think part of what you're just talking about now is re-granting the intermediary job. But what about the intermediary yourself? That's also what I'm asking. If a funder is funding an intermediary, and is there something that, in order to grow more BIPOC, to support more BIPOC-led intermediaries, is there something that you would like different from supporting a non-BIPOC-led intermediary?
I don't think that there's really any difference, because intermediaries themselves, I think, just from a strategic perspective, are typically connected to individuals on the ground who are doing the community work. So I think that it's just to seek out the intermediaries, right? Start with one and they'll generally connect you with the other ones. I think as an intermediary, as a program officer, we face some of the similar challenges that the organizations are facing as well, right? Gaining access to the funding, making sure we aren't being overlooked from larger, more established organizations. I think it's a cyclical issue.
I want to make one point about what you just said really quick. I think, obviously I'm not going to speak about, I'm white, so my input comes from, if you couldn't tell, from the outside. But I think something I've learned is that BIPOC-led organizations are even more connected to community and value community in a different way. And I think that's when you're trying to support intermediaries that are working with community-based organizations and providers, I think that there's value in seeking out BIPOC-led organizations because they have a different understanding of community and what work needs to be done. So I think it is different.
Yeah, I just wanted to add, first of all, another type of intermediary model is a pool fund, which I think is becoming more and more common. But then also to add to what organizations need, I think there should be a lot more funding to give these community leaders rest. There's a great foundation, I can't remember the name, but in Minnesota that granted rest awards. And it's for a lot of people that's such a radical idea, but especially for these organizations that are run by one person or just a small group of volunteers, they need to rest, they need to recover, they need to just have a life. And a lot of times, because of the work and how committed they are to the work, they just overextend themselves and just burn themselves out.
And it is such an investment in the sustainability. I think that's a huge part, that's what's going to keep these organizations going, is preventing their burnout.
And funding to individuals and businesses as well. Not everyone wants to go the route of a 501c3 or the hassle of finding a fiscal sponsor. sponsor, right? But there are other people who are doing the work who also require, similar unrestricted dollars, deep capacity building support, networking, collaborations.
So my organization, it does this intermediary work to some degree, but we also have the responsibility of reporting out to the community on overarching outcomes around infant maternal health. And so, in theory, the funding pushes the work and the outcomes, but in an effort to not exhaust the people that you're making grants to, if you reduce the amount of reporting, how do you then capture does that make sense?
Yeah. So one of the things that we modeled through the Caregiver and Family Leadership Grant was that we had regular check-ins with them. So we were capturing the reports and impact of the reports as they were implementing the projects. They didn't know that. They thought it was just a regular, hey, how you doing? And we did make sure that it was that type of comfortable environment. Even though they were all done virtually, it was very much a come as you are. So if they came on and they were just completely exhausted and they started ranting and, it may not have been anything to do with us, they had that space to do that. So I think creating that early connection, right? Building that empathy with them, understanding that this was a very relaxed space for you to come to us with. We were able to pivot when we encountered challenges, right? But that's still data that we captured in the process. So I think, that was the thing, the regular check-ins and not just relying on the end of, funding report.
I think we didn't do as much of this as I would like, but I'm hoping that funding gets renewed and we get to do this next year. But we started doing Instagram Lives with some of the grantees and interviewing them about the work that they're doing. And I learned so much from those conversations, and it was such a great opportunity to just share the work they're doing on the ground. So I think that was, and then being able to take notes from that hour-long Instagram Live where they're saying everything they're doing in the community, and then we just put that into a report.
Yeah, and I think that's the thing, right? Think the innovative ways we think about reporting, right? It's not just here's some questions, and we capture data throughout the entirety of the project without without burdening the organization.
So at the Foundation I'm at, we do trust-based philanthropy, so we've eliminated all the long narratives. We do all oral check-ins and things like that. But my question is for the intermediary work, because we practice in our relationship building, we wanted to build the trust with our grantees and partners, and we want to talk with them and understand what's happening. By utilizing an intermediary, does that separate us from not being able to have those check-ins with those partners? Are you all essentially replacing that, or how does that work?
Are we replacing the folks that they're serving?
No, they would talk to us, not Robert Wood Johnson.
Oh yeah, they don't.
They would not talk with us, for instance.
No, so as an intermediary, we did all the liaising with the Robert Wood Johnson Foundation. They at times were invited to give report and feedback to the Family Advisory Council. So it was a collaboration between Robert Wood Johnson's Family Advisory Council, which was coordinated by an outside group. They provided input to our process. And then in turn, throughout the process, the grantees were sometimes invited to report back, or either when we had those check-ins, that was information we were taking and feeding back to Robert Wood Johnson. And so it was completely intermediary, direct grantee relationship building. Now, if the funder, had some specific requests, like we have to do it in the project report, and they've asked for a couple of organizations to come and do a presentation, so they have that type of connection. But the funder, the larger funder themselves were very, they were very intentional about making sure that we built the relationships. We had particular regulations we had to work within, of course from their legal framework. But does that answer the question?
What I'm hearing though is from your question, is there a downside to that?
I think the downside of course of anything is being able to establish that relationship with the larger funder, right? But I think this was a little bit unique because RWJF wasn't funding this work, right? They did a series of, research and reports and found that, connecting to intermediaries was essential. And even though like we focus on birth justice, they weren't funding birth justice work. They were funding caregiver and family leadership, right? So we had to figure out and define what that meant as well. So there were a lot of reasons, I think, at this point why, but I think, the implication is just like not having that direct connection to the larger funder and depending on us to make the ask. I'm gonna go back here. I think, did you have? Yeah, go ahead.
I have two comments I want to make. One was about your question. You're from Celebrate One, so I'm in Columbus, so but one thing that we do at Tides is like convenings of our grantees, and during those conversations, we get a lot of that intel back of like their impact and what they're working on, and it allows for a reciprocal relationship, right? So they are able to talk to one another, they're able to ideate, innovate, build connections with one another. So we're able to get those reports on impact without them having to write them down or being like really cumbersome, and they're not like they're getting something out of it, but it takes a lot out of an organization to be able to do that. So we've gotten a lot of that information from doing convenings, and again, like I said, it's like a reciprocal type relationship. And then on the question about intermediaries, Tides acts as an intermediary, and I think one of the great things about Tides is that we are really progressive in the space. And so if we are talking to a larger foundation that is maybe not as progressive as we are, but we're working with a grantee that's doing really like progressive, sometimes radical work, we assess is there going to be an opportunity for like some harm to happen here? Should we connect them? Are they interested in being connected? So we don't make the decision for them, but we understand that sometimes some of our more traditional institutional funders do not yet have the language, the staff, all of those things to provide like a safe first space for the grantee. Sometimes the grantees don't want to talk to them, so it's kind of like a case by case basis based off of the relationship that we've built with the grantee, but it's definitely not meant to cut anyone off from the larger relationship with a funder.
Just to sort of, I think I'd love to hear from the room in terms of you all's experience. So our foundation we have a unique experience where we decided about 10 years ago that we were going to be also a nonprofit to be able to access funds that the local nonprofits could not. And so we get the funds, but then the challenge is that some of those restrictive, prescriptive funding and data requirements are still there. And so I'm wondering, for those of you who maybe are doing this already, what are some of the things that you all are doing pointed in that direction? So our funds are not coming just from other foundations, but coming from the government. And so not navigated through that to disrupt that traditional sense. I think someone mentioned it in our last meeting of collecting data or reporting while still mitigating and getting funding where it needs to get. So I don't know.
I mean, I don't suspect I have the answer by any means, but I think one of the ways I think about it is that it's like we're kind of a liaison between government funds and community organizations, and part of our work in being a liaison is not only money to the organizations, but also building their capacity to one day apply directly for the government funds. So I guess that's how I think about it. I think right now the role of a liaison or a conduit for government funds to communities isn't necessary evil that we're serving that role, but that as we keep focusing on systems change, we should be really building the community capacity to be able to be eligible for those funds directly. And part of that is also
they're organizations that have 0 deaths in their jurisdiction, so they're obviously doing something right, but how would they define success, and then how do we elevate what they define as success to be the standard by which we get? And I think that's a longer road, but I think for the moment, this intermediary liaison category that some of us are playing, it's a necessary evil at the moment.
Yeah, it definitely serves a purpose, and I think that for sure the capacity building is 100% a focus of ours. But then I also feel like in the same vein, if we just equip them to be able to meet this unreasonable marker, we're facilitating the system to continue to oppress, right? So then when, let's say that they do rise to the occasion where now they can get the funding themselves, there are still other very equipped organizations who can, but cannot play the game because of the umpires, right? Or whoever is controlling the game.
I think of it as like, 3 stages. It's like, 1 is to get them funding, 2 is to build their capacity to be able to compete for funding, but 3 is to change the terms on which they are competing for the funding.
Yes.
Yeah, and I would say it's not linear.
No.
It's like, and one thing that I've observed, and this is naively speaking, because I'm 90 whole days into philanthropy, right? But I've had 20 years of experience in nonprofit leadership. Is I feel like there's this appetite to either or in this field, and if we walk away with nothing else, life is not that simple. It's more complex, and when we talk about advocacy, it needs to be more than just us going to raise hell with politicians, right? We have, unfortunately, this great fortune to live in a capitalistic society and have access to capital, which means when we have a say in something, our voice may have more pervasive impact than some of our nonprofit partners. So we need to be intentional on how we leverage that voice too, right? So we can't just put the onus on our nonprofit partners to figure out this complex social ecosystem. I'll share one final thing that I heard, and I was taken aback by it. Someone said to me, it is not the responsibility of philanthropy to sustain nonprofits. And I was like, but that is exactly how our system was designed, right? So if in fact you say that it is not our job to sustain nonprofits, then what is our job? And I think we have a lot of organizations now, to your point, my friend, of serving in this quasi-nonprofit funder dynamic, which I find fascinating because it proves the one thing that I've said since I started this work: not a single business on the for-profit side would succeed if we put the same expectations on them that we do on nonprofits. And we infer that nonprofit organizations and their leadership don't have business savvy. I've heard a funder actually ask me, have you heard of this thing called a budget? I'm like, like, no, of course not. So I think the recognition that nonprofits are designed to fail, unfortunately, needs to happen, and we need to do more about lifting up that sustainability and removing barriers and thinking of the reporting not as you need to tell me what you did so I can feel good about where I spent my money, and more about what is the shared learning and what are those markers for social change that make us all feel like we're having progress. And you're not the community, we are our community. And you don't have just lived experience. I have lived experiences. You have lived experiences. We all have experiences that shape the way we show up in the world. And we need to stop othering and having that hierarchy and figure out how we can work alongside each other more effectively.
I think, and I'll come to you as well. I once told one of my bosses who built an identity based on her career and the work that she was doing in the intimate partner violence movement, and it has always rubbed me the wrong way because my sole goal is to work myself out of a job, right? When we decentralize work, we can focus on solving the issues, so we're no longer forced to work, right? Because if you look at this sort of from a space of how we are humanly as people, right? This is not normal. It's not normal, and it does not have to be normalized, right? So I think, to the point, yes, we have to, create spaces where we're deconstructing the systems slowly, right? More collaborations across organizational structures, right? Not just nonprofits, but again, social enterprises, social impact, individuals who are doing the work as well. Allowing the people you're providing the money to develop the process by which you're providing the money. It's that simple. Ask them, hey, how should we create this? What does this look like? What is it that you need? And then for regulatory purposes, create a pretty document and send it out into the world, right? But the focus should always be, decentralizing work as the central focus of our lives, so that way we can actually solve issues.
Thank you. I'm thinking about your question and what you were talking about, ties about my question of like, does the grantee want to meet the funder and have permission? And it has me thinking about the role of BIPOC-led intermediaries in my board chair facilitate a table on health equity, and it did not go well for her. And it just, I think about how I should have prepared her for that conversation better, and to be able to just have the skills to engage in those conversations and to do no harm, and that's on me to have not done that. But how can intermediaries kind of build the capacity of donors also? So if you've got the social capital already to be known as someone who is trusted and connected to community to be able to do this, then you can also leverage that social capital upwards and say, okay, we can have a convening and we can bring these people together, but this isn't going to be like poverty tourism, where you're just walking around and shaking hands and feeling good about yourself. This is how you engage, and actually using that as like a training opportunity, an empathy building opportunity, all of that. I feel like that is really exciting to think about.
That was something that RWJF did with us. Is when we provided feedback, they came back and said, we sort of envisioned one thing, or maybe we didn't envision this thing. We don't know. But you caused us to challenge our own processes and how we were delivering funding and how we were engaging. Because they don't provide capacity building support. And when we provided that information back to them, that was a light bulb moment, where one of the managing directors is like, oh, we hadn't considered that, and so they went back to the table and started sort of restructuring their own internal processes, both in focus areas and how they were sort of engaging with intermediaries. I think,
she's got a point, but she's from Robert Wood Johnson.
Oh, yeah.
No, I just wanted to go back a little bit about whether or not intermediaries distance us from grantee. What we have heard, we work with a lot of intermediaries, and what we have heard from some grantees is that it helps them to say that they got a grant from Robert Wood Johnson rather than the intermediary. And some of them have felt that the intermediary stands between them and getting to talk to us for further funding. So I think we also have to take that.
And that's a really good point. We were able, in most of our language that we use, we said that this is a Global Foundations for Girls project supported by, and the grantees were also, we got the clearance to make sure they could use that language as well, because you're absolutely right? That name carries weight in this space. And so that was critical for them. So we had really good program officers that we were able to work with that allow us to make some adjustments to how we approach it.
I think you had a point back there.
I was just going to say that I work in a corporate consulting capacity at times too, and so we had a corporate funder who I will not name, but they were one of the biggest, the top 5 auditing firms, and they were doing work, that they wanted to infuse community voice into their work. They already had grantees. And we had a situation with them where we were on a convening with them, and somebody from their staff, someone was like telling their personal story about like how they came to the work and what they were doing. And I got a text from someone on their staff that said, "This is taking too long. Can we move this along?" And so I'm getting to what you were saying is we have to re-educate people around what their expectations are as well.
Yeah.
Like, why do you think that just because you have the resources that you are able to treat people this way? So we had a meeting with them around, this is the way that you are required to show up. Otherwise, we will not continue to work with you.
Yeah.
And I think that we can do that with corporations. We can do that with individuals and families. We can do that with foundations. We can re-educate people around how they should be coming to the space, how they should be thinking about, why do you have the wealth that you have? You know, like those really deep questions that some folks will not be ready to have those conversations, right? But I posit that like if you start with a few people having that conversation, a few large donors, they're going to take that information and they can be influential in their communities so that they can start thinking about the way that they are showing up, and so I feel like a place like Ties that is large and well known, we are trying to influence the field in that way too. Like, let's talk about white supremacy. Let's talk about why you have all of these rules. Let's talk about why we shouldn't be doing it that way and then saying that we're going into strength and power in BIPOC communities. Like, those things are not, culturally, those things just look a lot different, and we have to be able to be accepting of those to have impact in this space.
Yeah. I want to end with saying, you know, it's time for us to get comfortable with being uncomfortable.
That's
right. You know, if we don't get to that space of discomfort, we'll never start, you know, asking ourselves the critical questions. And I'll end with, you know, just some community mapping considerations to take back with you. You know, think about resources and stakeholders you can identify in your community related to birth justice funding, connections and relationships that may exist between the stakeholders, and where you may be able to bridge some connections and collaborations, and then the opportunities for collaborations and partnership you can uncover and create, and then concrete actions you can take to support birth justice initiatives and address disparities in maternal and mental health. And if you decide that you would like to connect with us, we would love to have a conversation with you all about, you know, the work that you're doing, how you're looking to continue funding, if you're developing any creative funding initiatives, if you want to provide funding to an intermediary. We're here for you and look forward to convening with you over the next day or so.
Thank you all so much.